Hi, I'm Dr. Nathan Slovis from the Haggard Equine Medical Institute, and the topic today is going to be on ethmoid hematomas. How are they formed? What are some of the theories of their formation, treatment options, and also their occurrences? How often do they reoccur? So when people think about ethmoid hematomas, a lot of our clients think of ethmoid hematoma as a tumor. Well, it is not a tumor. It is progressive in nature, but what occurs is that you get hemorrhage or bleeding underneath the mucosa within the ethmoid turbinates. Ethmoid turbinates is a structure in the back of the nasal passage that helps humidify the air and warm the air. But there's also can occur, so some hemorrhaging can occur there. And what ends up happening, it ends up stretching the mucosa, so it ends up forming almost like a sac around this hematoma. And it can just continuously have this slow bleed. And unfortunately, we don't know why. We don't know if it's growth factors, like excessive vascular endothelial growth factors that occur, that cause the expansion of these blood vessels that could potentially hemorrhage and expand the mucosa. But what ends up happening, it can occlude the nasal passage, so your horse has problem breathing. So you can assess patency of the nares by putting your hands close there and see what the patency is. At the same time, what can happen, you can have just a trickle of blood intermittently. May happen one day, maybe not the next. Or excessive nasal discharge from one nostril. Majority of the time, the ethmoid hematomas occur unilaterally, but it can occur bilaterally. The problem is it can arise either from the ethmoid turbinates or it actually can go into the sinuses. So the clients have no idea anything's happening until they get some facial deformities, or until the ethmoid hematoma gets large enough in the sinuses that it'll start growing into the nasal passage, and that's when we can see problems as veterinarians as well as clients with a nasal discharge of some sort. But there's many other differentials that can cause hemorrhage or nasal discharge. That's why it's important to get your veterinarian involved. We can do an endoscopic procedure called rhinoscopy, where we put a scope up into the nasal passage and you're able to observe the nasal passages as well as the guttural pouches and get an idea of where the hemorrhaging or where this discharge is occurring. When it comes to ethmoid hematomas, you usually think of a middle-aged horse. It's usually a disease or disorder of a middle-aged horse, but it has been diagnosed in horses as young as 1 year, as well as our older horses. When it comes to treating ethmoid hematomas, there's 3 different ways of treating it. Well, there's actually more than 3, but there's 3 common ways of treating it. It's either laser ablation, where you use thermal necrosis, where the heat of the laser destroys the tissue structure, and hopefully can get down to the vessels that are causing the bleeding and just cause thermal destruction of those vessels, and therefore it can stop bleeding. The next thing is actually formalin. We can actually put formalin into these masses. What that causes is coagulation of protein. With the formalin injection, however, you may have to repeat it every 2 weeks for, could be up to 7 or 8 times, depending on the size of the ethmoid hematoma. Again, that coagulates proteins, can disrupt the blood vessels, can stop them from bleeding. When it gets really severe, such as our patient right here, you have to do a sinus surgery, which we've done on this patient before, and actually remove the ethmoid hematoma and hopefully be able to remove the origin of where the bleeding was occurring. But the biggest problem we have with ethmoid hematomas, is also known as progressive ethmoid hematoma, is the reoccurrence rate. Just because you removed it, you can't ignore or forget about follow-ups with your veterinarian, because they can reoccur. If they reoccur small, you can treat it quite aggressively, fast, and the good thing is you can slow down the reoccurrence or inhibit the reoccurrence. But they do recur up to about 50% of the time. So if your veterinarian does the procedure and it comes back a year or 2 later, unfortunately that is not uncommon. And so the most important thing is follow up on these after they do a surgical procedure of some sort to make sure they don't reoccur.